Okay, so this is my presentation on hoarding. Okay, so what is hoarding? So according to the definition, hoarding is a mental health condition which you have a strong need to save a large number of items and experience distress when attempting to get rid of them. So what does this mean? Basically, this is talking about how they form emotional attachments to items. It could be anything from like different types of trash to like magazines and stuff like that. This can literally be anything that they form attachments to. And then when you try and go in and clean everything out, they physically cannot let go of these items because of the emotional attachment that they have found, that they have formed with the item. And I have a quick video right here. Just give me a sec. Okay, so the video is not loading. The video literally just goes over how hoarding is different from clutter and how they're not the same thing and like what separates the two, because sometimes people get confused when they're talking about hoarding and clutter. Okay, so what causes hoarding? So there's actually not a one specific cause of hoarding. They're still unclear and still researching what causes it, but what's being studied as possible causes is genetics. So obviously, say someone in your family is hoarding, there are studies that show that you can be more genetically predisposed to be more susceptible to having a hoarding disorder, which I've seen this in my own personal life. My grandparents are hoarders, and their daughter, my aunt, is also now a hoarder, although they're getting better, so it's okay. And so they're all being studied as different causes, but there's no actual cause of hoarding. So they think it also stems from different like mental disorders like depression, anxiety, and OCD. There are studies that show that if you have like one of those 3 other mental disorders, you are also more predisposed to developing the hoarding disorder. So you talk about hoarding, talk about how you get it, but how much of the population is actually affected by hoarding, this disorder? So basically, not a lot. It's like, according to the Cleveland Clinic, approximately 2 to 6% of people in the United States have a hoarding disorder. It usually begins early in age, well, not early, but like in a young adult, and then if left untreated, it gets worse over time, like a lot worse. It is more likely to affect people of the ages of 60 and older, and people that have underlying mental disorders like anxiety and depression. So that's the slide for that one. It also there's a very specific demographic of people that are more susceptible to developing hoarding, and that's like, people who live alone, people who have mental illnesses. They are like 60 and up. People who fit that demographic are usually more susceptible to having the hoarding disorder. Okay, so you talk about how many people are affected, but what do you look for when people are like, I think someone in my life has the hoarding disorder? So these are symptoms that you need to be looking out for. You need to look out for like if they're having difficulty throwing things away and like letting go of like throwing away trash and things like that. You need to look out for things like that. There's like just clutter around the home. There are different like there's clutter, and there seems to be more and more like every time you go over there and like see them. There's just more clutter, and it's increasingly becoming more like you can't move around the house. There's piles of items. Again, this goes along with the first one. There's just piles of items around the house, and it seems like, you know, they have no meaning, but to the people that they do have meaning. And then the spending time moving things from pile to pile and not letting go of items. So this is them just like moving their items around, and just, you're like, hey, like, we can throw this out, and they're like, no, like, we cannot throw this out. And then problems with attention, and then this is the slide for that. So who does it affect? So really, the main thing about the hoarding disorder is that it affects everyone around the person included. So I had a video on here. It is also not loading at the moment, but it was this house. It literally had feet of trash just outside of it, and it was inaccessible, and it got so bad that the neighbors started complaining, and they had to get the city involved to remove all the trash. So that's an example of like what happens when it gets so bad. You know, community members are affected, like socially your people are affected, but it affects the family too. It strains the family dynamics. It creates frustration and just tension on both sides. People are feeling helpless and stuff like that. Yeah. And then it personally, the actual person suffering, it affects them in the sense that, like, you know, financial strain, like they're spending all this money on stuff and keeping it, and their home is neglected. You know, they can be evicted in extreme cases of how bad the house can get, you know. So it affects everyone involved. And then, but how do you treat someone with this? In order to treat someone, oh, let's go back. Here's my slide for who does it affect. That's my slide for that. And then how do you treat someone? So the most effective treatment is CBT, or cognitive behavioral therapy, which is a psychological treatment that has been effective for a range of problems, including depression, anxiety disorders, alcohol and drug use problems, marital problems, eating disorders, and severe mental illness, which is what hoarding is. It is a mental disorder, so CBD works the best. You need to get them to want to have help, or else the therapy will not work. And it's important you intervene at a early young age when you start seeing the signs and stuff, because the more they are stuck in the hoarding disorder, they're suffering with it, the less likely they are going to want help, and they're just going to continue living their life how they are. The big question is there any medications that work? So there is no medication that can treat the hoarding disorder, but there is medications out there that can treat the underlying, like, other mental disorders that go along with it. There's medication for depression, anxiety, and things like that, which usually people that have hoarding disorders also have that. So there are medications that can treat the other mental disorders that go along with it, but not hoarding disorder itself. So yes and no. And then the outcome, so as long as you have helped them stick with the treatment, studies show that there is an improvement and that they do get better, but you have to be consistent, you have to be supportive, and they have to want to get better. The whole basis is that they will not get better if they do not want to get better. And that is my presentation.